Hello, I'm Dr. Rosemary Guerguerian with NBC News. I'm an ER doctor, and I'm here to answer your questions about the coronavirus. So if you have questions, please make them in the comments, and I'll try to get to as many as I can. While we're waiting for some questions, I'm going to talk about a couple of other things. So there is a lot of attention right now on face masks and bandanas and whether or not people should be wearing scarves. So I want to talk about that for a few minutes. So first off, neither the CDC nor the World Health Organization is currently recommending that the general public wear masks. What we need to think about in all of this is the science and the facts. And so there's been a lot of research done, not necessarily with coronavirus, but with spreading respiratory infections in general. And the number one thing you can do to prevent spread of respiratory infections is wash your hands. That studies have shown time and again works better than wearing a mask, than wearing a gown, wearing gloves, better than all of those things combined. Washing your hands is the number one thing you can do. The second thing is don't get close to someone else. That's it's pretty intuitive, is that if you do not get close to someone else, you are not going to get close to those respiratory droplets. So between washing your hands and keeping your hands clean after you touch surfaces and whatever, and not touching your face, and then staying at least a 6-foot distance from other people, that's going to do more to prevent spreading a respiratory virus and spreading this coronavirus than any of that discussion about wearing masks. Now, when we're talking about masks, you have to understand people wear them for two different reasons, okay? There's the not wanting to spread disease to other people and then wanting to protect yourself. So there's the not wanting to spread disease to other people. When you see doctors in the hospital, like a surgeon who's wearing a mask during an operation, he's not wearing the mask necessarily to protect himself. It's more because they don't want their respiratory droplets while they're speaking and things like that to go down into the surgical wound and cause an infection. The same thing goes when we're around patients who are immunocompromised or patients who have cancer. We're wearing masks to protect them, not us. And when there are patients in the hospital that have respiratory illnesses, one of the first things we do is we put a mask on those patients to protect everybody else, because those patients, whether we like it or not, they're going to be moving through the hospital. They're going to be going down to radiology to get x-rays and things like that. And so we put the mask on them to protect everyone else. And then that's the capacity in which the WHO and the CDC recommend masks for the general public, is that if you are sick, you should be wearing a mask to protect other people. Now, you could make an argument for, well, it's a bandana and who is it going to hurt? So one of the downsides to that is that when you're wearing a bandana, you're going to be a lot more likely to touch your face and adjust it and things like that. And so you may actually even increase your risk by wearing a bandana or a scarf. I can understand if you're taking care of someone who's immunocompromised or someone who's elderly and you're just a regular caregiver and you want to protect them and you have to get close to them. In that scenario, I can see reason to wear a mask or even a bandana or a scarf, as long as you're still washing your hands and being really careful about surfaces. In a hospital, in terms of medical workers, that's a completely different scenario. Doctors have patients coughing in their face. They're putting in breathing tubes. They're using a bag to oxygenate people. And that is kicking up virus literally directly into their faces and spraying them. In that scenario, a mask is not enough. They have the N95 respirators, goggles, face shields, surgical caps, gowns, gloves, the whole deal, because they are right there. It's all happening in that close distance, and they have no choice but to get that close to patients. And then the second thing that I wanted to talk about is there's also been a lot of questions about testing, about being able to get testing and can I get tested or not? Or even, are the tests having false negatives and false positives? And so here's the thing. So with tests, any test that we do in medicine is going to have false positives and false negatives. There is no test out there that is 100% perfect. We don't treat the test. We treat the patient. So even if you can't get a test, if you've got a cough and fever and shortness of breath, we're going to take care of you. We are going to consider that it could be coronavirus and we're going to act accordingly. So the testing is more from a public health interest where we want to know where these cases are. We want to know how quickly it's spreading. You know, if in an ideal world, we'd be able to identify anyone who has the virus, even if they don't have a lot of symptoms, so that we can reduce the spread. But from a personal level, doctors are going to take care of you. They're going to take care of the patient, not the test. And so that's something that's going to come first. Now I'm going to open up to questions. So do we have any questions?
So Nancy had a question. She was asking in regards to from time of exposure to when somebody might become contagious. How long does that usually take?
Okay, so the question was, from time of exposure, how long does it take to become contagious? And so I don't know that there's that specific number. I do know that from time of exposure to developing symptoms is about 4 days. And I would say that, you know, you can still be contagious prior to having symptoms. Now, the more symptomatic you are, the more contagious you're going to be. So the more you're coughing and having those respiratory droplets, the more contagious you're going to be. In that period before you're symptomatic, or if you're just having vague body aches and fevers and things like that, you can still be contagious. And so I know the average amount of time before symptoms is about 4 days. I would say that, you know, if you've been exposed, the best thing to do is just assume that that person is going to be contagious.
Okay, another question that's been asked recently from other people is about pregnant patients that are giving birth, so COVID-19 patients that are pregnant.
Okay, so the question was about pregnant patients who have coronavirus and are giving birth. And so first things first, there's a lot of question about whether or not the coronavirus can be passed to the baby during pregnancy. There are very few viruses in this world that do that, and when they do, they have enormous consequences. So for example, Zika, it crosses the placenta, it causes birth defects. So far, we have not seen that that is the case with coronavirus. Now, we learn about this virus every day, but so far there's been no evidence that that occurs. When they tested the amniotic fluid of women with coronavirus, they did not find the virus in the amniotic fluid. In terms of the time around birth, there is some suggestion that the coronavirus transmits from mother to baby in that time around birth. Now, whether that's during the birthing process itself or if the baby's getting exposed immediately after birth, there's still some question around that. There's been a few studies out of China. There's one with 33 infants. 3 of them got sick with the coronavirus. All 3 of them survived. They did well. 1 out of the 3 got a little bit sicker and ended up needing ICU, but that one was also premature, and the doctors believed that the issues that resulted in that baby ending up in the ICU were more related to the prematurity than the coronavirus infection itself. But all of those babies did well. And then there's another study that looked at whether or not babies are born with antibodies to the virus. And what was interesting about that one, and this is going to be a little complex to explain, there's 2 different kinds of antibodies. There's IgM and IgG. IgM is the first one to rise, first line of attack, and then IgG develops later. IgG is small enough to cross through the placenta to the baby to protect the baby. And some of the babies that were born to these mothers, they did blood work pretty much at birth, and they found that they had IgG in their system. So some of those antibodies do cross through. What was particularly interesting, though, is IgM is a much larger molecule, that first antibody that fights the virus, and doesn't generally cross the placenta. Well, they had just a few babies, I believe it was 2, that actually had IgM in their system, and that's not supposed to be able to cross the placenta. So there is some question as to whether or not those babies were somehow exposed to the virus prior to birth, or even particles of the virus that allowed them to develop their own IgM antibodies, or if something else happened that allowed those IgM antibodies to cross the placenta into those babies. None of those babies, by the way, had symptoms of coronavirus, and none of them tested positive on nasal swab. And so it is very compelling as to what happens, but there's some evidence that maybe definitely the IgG antibodies can cross the placenta and protect the baby. And then there's a debate about whether or not those babies are exposed to the virus prior to birth and making their own IgM antibodies, or whether they're getting their mom's IgM antibodies.
Okay, and Eileen has a question in regards to, she's been sewing cotton masks like a lot of people have in order to help donate them. And she's asking if they're still useful now.
Well, so in regards to the cotton masks, right now, in terms of the healthcare workers, they really need to be having those N95 masks if they're getting close to patients. And for general use, different hospitals are kind of coming up with their own policies as to whether or not they should be wearing surgical masks. Now, the cloth face masks may come in if they get low on supplies and they need to re-wear those N95 masks. They may be able to put the cloth masks over top of the N95 mask just to keep the N95 from getting dirty. So there is some role there, and there may be some role in the general population. We're not there yet, but there certainly is some uses for those. It's not going to be for the front line. I'm being coughed at. People having a cloth mask is not going to offer the kind of protection that healthcare workers need.
So Aaron just asked, is there any valid research on blood types in regards to vulnerability from this virus?
So I have heard I have heard some stuff about certain blood types having less vulnerability. I got to be honest with you, I'm not sure why that would be. And I don't know that the data is that established yet.
Okay. And then are there any new eye symptoms or any eye symptoms that are related to coronavirus?
Okay, so the question was about eye symptoms with the coronavirus, and there was a study that came out of China that looked at that. They found that about a third of patients actually did have eye symptoms. They had essentially like conjunctivitis or pink eye from the coronavirus, where they had redness of their conjunctiva, and some of them actually had edema of the eye itself and extra tearing. But in those cases, the vast majority of those were folks who had advanced and severe disease. And so they actually looked at that more as a correlation between having severe disease and having higher levels of inflammation causing those eye symptoms. I believe out of 12 patients, there was one who actually presented with eye symptoms before the cough and fever. So that's not a common presenting sign. It is something that can happen with the coronavirus, though, about 1/3 of patients.
So Jen asked, is there any over-the-counter medications that you can take to help alleviate any sort of symptoms? Specifically, she mentioned Advil isn't advised. Can you elaborate, please?
Right. So this is a question about what over-the-counter medications can you take for coronavirus symptoms. And specifically, there's been some debate about whether or not Advil or ibuprofen can be harmful. That came out of a recommendation in France, which was based on what we call anecdotal evidence, meaning a doctor was taking care of some patients and happened to notice they seem to get worse. That's not something that's been proven. And so there's no definitive reason right now to say that you shouldn't take ibuprofen. That being said, if you have the option to take Tylenol and we're a little bit nervous about the ibuprofen, it's perfectly fine to take Tylenol to reduce the fever. It's also okay to take over-the-counter cough medications like, Mucinex, or Robitussin, those kinds of things to help with the cough and your symptoms. And of course, if you think you have the coronavirus, definitely call your doctor or call a telemedicine service and talk to a physician, and they can help guide you as to what other things you can do to help your symptoms and help you feel better. So that's going to be our last question for today. Thank you for joining me, and stay tuned with us on NBC and all of our platforms to find out the latest news on the coronavirus.